At Complete Cosmetic Care Dentistry, we do offer traditional braces, which is the metal and the wire to move the teeth. We do offer invisible braces here. We do use Invisalign treatments. They're clear aligners that you wear. You change your tray out every 1 or 2 weeks depending on your treatment time, and it helps align your teeth without having all the metal in your mouth. And with orthodontic treatment, we do both adults and children, and a lot of times we do interceptive treatment, which is when the adult teeth start to come in. It's usually the front four and then their back molars. If we see or anticipate some issues that will develop later, or problems that we can resolve early on to make their eruption pattern a little bit more favorable in the future, then we'll do something called interceptive treatment, where we'll correct a problem now to prevent a bigger problem from happening later. Notice a lot of kids with braces that have different colors on their braces. If they're doing traditional brackets, they get to pick and choose the colors, and they can change them every time they come in. The colors are basically just elastic rings that will hold the wire in the bracket to help it move the teeth the way we want it to move. Some of the early symptoms of orthodontic problems that we'll see are usually arise in the age of like 6 or 7 year old is when we notice it the most, when their first 4 teeth are coming in and their back molars are in. If we see a lot of crowding happening, or we foresee any permanent teeth being blocked out because of the position of these teeth, then we'll want to do something called interceptive treatment. What we do with interceptive treatment, we try to align the first 4 teeth, get them in the right position and the right angulation, and allow enough room for the other permanent teeth to come in without them being blocked out. Whenever you have braces, you should brush your teeth about the same, if not more, than when you don't have braces. There are different techniques and different brushes that we provide you to do that hygiene at home, but you should never brush less than 2 times a day, preferably every time after you eat. Teeth do like to move. Just like anything in your body, with time you age, so does your teeth, so does your bone structure, and with that comes minor movements and minor relapse. So anytime we finish orthodontic treatment, we usually will put you in a retainer both on top and the bottom, and depending on the severity of the case, your retainer may be a lifetime retainer, or it could be something that comes in and out that you wear just at nighttime. But either way, retention is always part of the treatment when we finish orthodontics. Whenever you have braces, you can still participate in extracurricular activities, and you can still do sports like normal. If you're any sort of contact sport, because you've got wires and metal in your mouth, if you get hit in the mouth, you can cut your lips or tongue and cause injury. So a lot of times we'll make you a sports guard that you wear on top of your braces and your teeth to help protect your tissue and protect your teeth from that injury should an impact happen. With aligners, you really don't need any extra protection. You can participate in any sports as usual. If you do have a removable appliance in your mouth, we do ask you to take out the appliance whenever you are in practice or during a game, and then when you're back at home and you're not doing the sport, will you put it back in.